Hello, my name is TJ Donovan, and I'm going to do my hair. Well, I talk about something that's very, very important to me, which is Black maternal mortality rates and inequities in those in the US. So basically, I'm referring to an article here that's from Stanford Medical. That's the one article that I chose. There's tons of information out on it, though. Um, and it's entitled How California is Taking on Inequity for Black Patients During Pregnancy and Childbirth. And the opening paragraph says that across the United States, Black women are 3 to 4 times more likely as their white peers to experience life-threatening pregnancy complications or die giving birth. Given that the U.S. maternal mortality rate of 32 deaths per 100,000 live births is 10 times higher than that of countries with the lowest rates of maternal death, the inequity is setting off public health alarms. So I just want to do my part and try to tell you a few things to do in this situation. I'm not an expert, I'm not a doctor. I refer back to this article, which is a great article because the person that they interview is this Dr. Amanda Williams, and she is a Black doctor, a OBGYN, as a matter of fact. And not only is she that, but she's also the head of the department that does this research for Stanford. And she also has a ton of other qualified information about her. But what she does go into this article is how California is doing their part to be among one of the lowest in these stats for Black women giving birth, and what they've done and what they've figured out, as far as it being education level and socioeconomic status and all the things that are causing these inequities. But then, interesting enough, she goes into the fact that she has her own birthing story, and it isn't good. So basically what she says is, she says that she is a preeclampsia survivor, and she could have not been of any greater academic privilege, being the chief residence in OBGYN at the University of California, San Francisco. And she was still a severe maternal morbidity patient. She said when her son was born in 2004, she had an iatrogenic preterm birth. She was induced 5 weeks early so she could start getting better for her preeclampsia. And then her baby went into the neonatal intensive care unit. And not surprisingly, she had significant postpartum depression following his birth. So, and she goes on to say, being privileged wasn't enough. Excellent clinical care was no match for the impact of systemic racism. So basically, she's saying with all her doctorates and all her doing this and doing that and doing that and all her status, she still suffered because of systemic racism. And she said everything else that the department has discovered in trying to figure out these inequities and try to do something about them, the things that they were working on were low-hanging fruit. And the biggest part of it was the systemic racism. So that's the biggest thing that they have to really try to tackle, to try to, close this gap in Black maternity rates. And so it's pretty interesting. It's an interesting article. I suggest that you go back and you read it yourself. But I also suggest that if you are pregnant, planning on becoming pregnant, know somebody that's pregnant, please, please, please share this video with them. And the 3 things that I will say to do, she goes on to say about what they're doing on their part to close this gap in inequities. But I feel like, if everyone can start spreading the word as much as they can, and really just, I think we're coming from a time where we just really just would, go to the hospital to have a baby, and we rely on the doctors and everyone around us to tell us what to do, especially if it's your first time giving birth. And we kind of go in there ill prepared. So my thing to you, I have about just a few things that I want to tell you to do. And I'm going to start with the first thing, which is do your part. I mean, really do your part to educate yourself. Like, that's huge. A lot of times we sometimes rely on what the doctors and the medical team around us are saying. But as this article goes into, and any other data or research that you do, you'll find out that things like cesarean C-section are given to women unnecessarily and at a rate that's too high. And when you, even in this article, it says that sometimes when you get a C-section and you don't need it, then the pregnancies after that may have more complications because you started out with a C-section that wasn't even really necessary. So it's things like this, or like this doctor is saying with her preeclampsia, she would have known to take an aspirin, a low dose aspirin during her pregnancy. She would not have had the complications at birth that she had. And she was an OBGYN. So that goes to show you how important it is to go in there and do your research, educate yourself so that you can come up with questions to ask your team and get questions answered, and also have a voice for yourself. It's already hard to have a voice when you're going through something, when you're giving birth, and you're going all through everything, the pain and everything that you're going through. But if you don't know what to say or what to ask or what to do because you haven't taken the time to, figure out what all these terms and everything, the medicines and everything that they want to give you, the epidural, things of that nature, then, you won't be able to have a voice. And they're going to be able to be like, if they want to give you a C-section and it's unnecessary, they're going to give you a C-section or whatever it may be. So that's the first thing that I want to say. Have a voice when you go in there. Have a voice. Educate yourself during your pregnancy. Ask questions and have a voice. Advocate for yourself. Or if you have a friend that's pregnant, be their voice, be their person to get all the information and ask all the questions. Because at the end of the day, it's going to help. It's going to help from our end to close that gap. The second thing that I want to say to do is hire a doula, or like I said, have a birthing coach or someone close to you to help you through the process, not just your partner or your significant other, but someone who actually is going to be there, because a lot of times your partner is just as emotionally involved and they may not do what is necessary. So you can appoint someone, but I highly suggest to get a doula. Get a doula. They know what they're doing. They're educated. They're also advocates, birthing advocates. They're allowed in the hospital. They were allowed even during COVID. They would allow you to have, in some states, a doula. So, definitely do your part to have that advocate for you in the room, because when you're in there and you're giving birth, you're going through all types of things, and having someone else in there to advocate for you helps. Not only that, but some doulas, like my daughter's doula, knows baby turning techniques. If it wasn't for her turning my daughter's last 2 babies, they would have given her a C-section. So, a doula can be a voice when you're going through a hard time. And mind you, I'm her mom, and I was in there with her as well. But the doula kind of knows the medical terms and knows who she's dealing with and knows how to get through to them in different ways. And then the last thing that I want to say is definitely have a birthing plan. When you're in your pregnancy, educate yourself, look up what an epidural is, look up what other kind of drugs there are. There's some that crosses over to the baby, some that don't. Decide if you want to just have a completely natural birth. Do what you got to do. Like if you want to do it, like for me, I was like, look, I definitely don't want an epidural, but we all start out saying we don't want an epidural, and then the pain gets so much that you're like, where's the epidural? So what I found out during one of my births is that if I would have just waited a few more centimeters, I ended up having the baby before the epidural kicked in. That's what happened. So it wasn't even necessary. So basically, then I learned from that, like if I'm in my birthing plan, if I'm dilated anything past 6, do not give me the epidural. Let me know that I'm to 6. And even when I let myself know, 6, I only have 4 more to go, I'm okay. I don't need the epidural. It gives me a little bit more strength to think that I can make it through. So have that birthing plan. Please have a birthing plan. Please look it up. Please find out what it means to be induced and how that increases your labor pains, and what it means, when they, maybe want to, do a C-section, and, how you can advocate for yourself and what questions you should ask. And, so, there's a lot of things that, when I was doing the research on this, just to put this message out here, there's a lot more things that I could get into. But for the most part, basically what I want to say is these 3 things: do your research, educate yourself so that you can have a voice and know what it is that you're going through, and know all the terms, and know what questions to ask, and go in the hospital go to your team with the list of questions even before you go into labor. Hire a doula. If you can't, some doulas will work with you financially. But if you can't, then get a birthing partner to help work out your birthing plan. And that's the last thing, get a birthing plan. But please advocate for yourself. And please don't go in there and be silent, because that's the worst thing that you can do for both you and your child. And just do our part to help close this gap in inequities in maternal health rates. Thank you. Be blessed.